It's been mentioned about grinding and the connection with airway problems, and I've read a few things recently on some forums which I think are hurdles not only to patients but also to us as dentists who are trying to either fix the problems or try and explain why the problems exist. So the idea, I think, behind the connection between grinding or bruxism and airway problems is and has been suggested to be really quite simple, which is the idea of a closed airway opening by bringing your jaw forwards is something that most of us are familiar with, especially those of us that make appliances or those of us that wear appliances. And so the idea is that you bring your jaw forwards and you open your airway. Okay, so far so good. Problem is that the teeth are in the way. And so consequently, the suggestion has been that when you move your jaw forwards and your teeth are in the way, you grind your teeth out of the way. Bruxism. And it's certainly been my experience clinically that people whose teeth are worn at the front, which would seem to go in with moving your jaw forwards, do seem to have more of an association with obstructive sleep apnea or any kind of sleep disordered breathing. Now, bruxism can be, and it's multifactorial. We know that there are many causes of bruxism. At one time, everybody thought it was just simply stress. And there is a difference between there's a difference between grinding during the day and grinding at night. Grinding during the day, we're talking more about nighttime grinding, but grinding during the day probably does have a very large stress component. It may also have a habituation, a habit, maybe a habit aspect to it too. And then bruxism at night is probably not just related to an airway issue. It can also be related, I believe, to stress. It's also can be a centrally mediated issue. In other words, it's brain driven by rhythm centers in the brain. And then the other thing, of course, is, well, what about people who grind their back teeth but they don't grind their front teeth? Well, I think, once again, this is anecdotal, this is just my opinion, but I think that a lot of times we see that when there's grinding on the back teeth, there may very well be a discrepancy in the bite, and I rightly or wrongly feel that some of the wear may be the body's attempt to resolve that issue by getting rid of the quote-unquote interference. Now, it's obviously a lot more complicated than that, and they've done a lot of neurological studies, and they found that there is definitely some relation with the airway compromise. Jumping around a little bit, but going back to the issue that it's that it has an airway component. So what I'm really saying is it's not really that simple. I don't think it's well, you've got signs of wear on your front teeth, you're obviously bruxing your front teeth, therefore you've got an airway problem. Nor do I suggest for 1 minute that it's just the case where you've got grinding on your back teeth, that it's simply an occlusal interference, us dentists, or a bite that's not quite right that we're trying to make right. Now, hand in hand with bruxism, and I use this not physiologically but in sort of classification, we've got clenching. And clenching is not side to side grinding or forwards and backwards. What clenching is obviously increasing the muscles. You clench your teeth, so it's not wear per se, it's just physical clenching in a sort of vertical way. So consequently, for the clencher, we don't see those kind of wear patterns because the grinding is not taking place. But nonetheless, I suspect that there is an element of these things in there too. They're just, if you like, there's different weightings to different things. And I think that clenching may very well be, this is my opinion, may very well be related perhaps more to stress. But I do think that there are probably other physiologic issues as well. So, okay, the reason for going through all this was because we do see, and I have personal experience of this too, we do see that sometimes when we've given someone an appliance, this goes for CPAP as well, the grinding doesn't stop. Now, if the only cause was the airway, it would stop, assuming it was effective. On the other hand, since it doesn't, you're forced into the position that either A, it's not that purely that relationship, there are other things involved, B, that maybe there's a time delay, or C, there's something else going on that we have no idea about, and who knows, there's possibly a little bit of each. But to the person that wears an appliance that grinds or clenches, still, there will often be other issues that either become more apparent that weren't apparent before or just continue. And one of those is your tongue. One of the things that dentists look out for is ridging of the tongue when there are airway issues or grinding issues or TMD, jaw joint problems. And it's because the jaws are being clenched and the tongue is moving out to help brace the jaws. And so consequently, the tongue can get really quite sore. The tip of the tongue can get sore if there's a component of, I forgot what the word is now, but if there's a component of the tongue being forced forwards, tongue thrust. If there's a component of tongue thrust, then obviously the front of the tongue is going to get sore. If it's what we call lateral thrust, in other words, a thrusting sideways to help to brace the jaws, because you can't swallow without your jaws being together or braced in some way, then you're going to notice tenderness on the side of the tongue. So the $64,000 question is, so what do you do? Well, we've already said that it's not necessarily that easy to resolve it. Certainly you can consider attaching the top and the bottom components of an appliance, but if you think about it, if it's the tongue that's doing the work, it doesn't really matter too much whether or not there's an appliance in or not. It's just becoming more apparent with the appliance. The problem is, if you don't wear the appliance, then you're going back to the issue where your airway is not open, and then it may very well be worse. Well, let's face it, it would be worse, otherwise there'd be no point in wearing the appliance. So it's all round, it's a sticky issue. But on the other hand, from my own experience, my domestic experience, you can write your own thing into that, and also from being a dentist that's done this for a while, I do see this as a waxing and waning. In other words, I see people complaining about problems and I'm trying to think of a solution, and then as the days go by or sometimes the weeks go by, I'll say, how is it? And they'll say, well, actually it hasn't been that bad. So I guess what I'm really saying here is it's been referred to as an enigma. In other words, something that we don't understand. It's probably going to remain a mystery for a long, long time. Body is especially the brain, is a very complex organ, and practicality says you kind of got to ride it out. It may be that there are things going on in your life that are bringing other aspects in as well. Stress is like the obvious one. So I don't think we always have the answer. If anybody does have the answer, please let me know. But sometimes you just kind of roll with it. But that doesn't mean to say you're on your own. You should still share any concerns you have with your dentist. But there's not always going to be an immediate resolution. Not always. And we can't relieve stress. If we could easily relieve stress, we would do it. for ourselves first. Anyway, so thank you. I hope that didn't leave, well, I suppose it did leave more questions than answers, but it's where we're at the moment. Thank you.